Good afternoon, everyone. It's a great honor to present my research today. The topic of my report is preferences of Chinese caregivers for their daughters' HPV vaccines and surveys. Cervical cancer, primarily caused by human papillomavirus infection, is the first most common cancer in women globally. China accounts for about one-fifth of global cervical cancer cases annually, and the incidence and mortality rates of cervical cancer in China has been on the rise and tend to be younger. The HPV vaccine serves as a highly effective preventive measure against cervical cancer, and was introduced in China in 2016. But at the end of 2022, first dose coverage in the 9 to 14-year-old group was only 4%, significantly below the WHO's 2030 target of achieving 90% full vaccination among girls by the age of 15. Since caregivers' consent is required for HPV vaccination of girls aged 9 to 18 years, vaccination rates are largely determined by caregivers' attitudes and perceptions. So understanding the factors influencing caregivers' decisions about HPV vaccination is crucial. Currently, most research focused on preferences regarding HPV vaccine attributes, while largely neglecting preferences related to vaccination surveys. So our study aimed to investigate the preferences of Chinese caregivers for HPV vaccine profile characteristics and service delivery method for adolescent girls. Discrete choice experiment is an established stated preferences method increasingly used in healthcare to inform patient-centered service design. Our study included two discrete choice experiments. The first DCE focused on preferences regarding HPV vaccine relative profile, and second DC access preferences for vaccination service delivery method. Our study target participants were caregivers of HPV vaccine naive girls aged 9 to 18 years and can independently complete the online survey. We identified potential attributes and levels through literature review and then refined by experts for clinical and policy relevance in the Chinese context. 7 attributes were identified for HPV vaccine types. Based on the WHO's 2022 HPV vaccination guidelines, we have added those attributes, and we included the place of manufacture as an attribute because participants may weigh traditional trust in imports against growing domestic vaccine confidence. We think it's a uniquely Chinese decision-making contest. 6 attributes were identified for the second DCE. In the message frame attributes, positive information emphasized the reduction in the incidence of cervical cancer after receiving the HPV vaccine, while negative information highlights the mortality rates of cervical cancer. Injunctive norms and basic information emphasize the age groups prioritized for vaccination. We utilized a D-efficient design to maximize the information collected from each choice and incorporate an opt-out option to enhance the realism of decision-making scenarios. Our complete questionnaire also included participants' characteristics and vaccination intention. Between November 2024 and March 2025, a total of 301 participants were recruited from individuals undergoing health checkups at Jiangsu Provincial People's Hospital and the vaccination clinics at 3 community health centers in Hangzhou. The mean age of the participants were 41 years and the mean age of their daughters was 12 years. 74% of the participants were mothers. 88% of them had attained relative high educational levels and 42% reported high economic level. We used a mixed logic model to assess the preferences. 5 vaccine attributes significantly influenced caregivers' decision-making regarding HPV vaccine selection. Participants preferred vaccines offering higher protection against cervical cancer and genital warts, lower risk of severe side effects, imported vaccines, and reduced prices. We analyzed the relative importance of attributes for the HPV vaccine. The selection of a vaccine was most strongly influenced by the degree of protection against cervical cancer, followed by the risk of severe side effects and the protection against genital warts. For HPV vaccination service, caregivers preferred vaccination recommendations from physicians, positive promotional messages, online appointment scheduling, school-based vaccination, and incentive measures, including one free dose and a coupon for left-behind girls. Conversely, caregivers do not prefer vaccination recommendations originating from school and native promotional message. And the source of vaccination recommendations was the most influential factor, followed by the incentive measure, vaccination location, and appointment method. Also, 77.4% of participants expressed plans or willingness to take their daughters to get vaccinated. More than half reported hesitation or postponement, and 20.3% to outright refused. The primary reasons for hesitation, postponement, or refusal include concerns about vaccine side effects, uncertainty about vaccine efficiency, and the perception that their daughters were at low risk of HPV infection due to a lack of sexual activity. In conclusion, we found that caregivers of girls aged 9 to 18 years prefer HPV vaccine for higher protection against cervical cancer and genital warts, lower risk of side effects, and affordable price. As they prefer physician recommendations, positively message, and convenient service like online appointment and school-based vaccination. We also found that despite caregivers holding generally positive attitudes toward HPV vaccination, persistent concerns regarding side effects, efficacy, and perceived low infection risk remain substantial barriers. That's all my presentation. Thank you.